Breaking news now in the fight against COVID. Pfizer has announced the start of trials for its omicron-specific vaccine booster, as the World Health Organization says the variant could be ushering in the end of the emergency phase of this pandemic. Trevor Ault has the latest on this.
A new weapon being tested in the war on Omicron. Pfizer announcing the start of trials for its Omicron-specific vaccine booster, with more than 1,400 trial patients set to receive one or more doses of the variant-based vaccine. Though experts say it doesn't appear a strain-specific booster is necessary for people who are already vaccinated and boosted. One of the categories being tested is a 3-shot course of the vaccine tailored for Omicron in patients with no vaccinations at all. It comes just as the FDA has pulled emergency authorization for monoclonal antibody treatments by Regeneron and Eli Lilly. The treatments used to treat early mild cases in unvaccinated people and some breakthrough infections were found to be ineffective against the Omicron variant. As official calls to stop using the treatments have grown, the final cutoff causing massive disruptions in some states.
While this virus continues to surprise us in all sorts of ways, I do think that we're heading to a better place.
And there have been recent signs of hope in the pandemic as 31 states see new cases level off or decrease. But as one World Health Organization director warns, it is far too early to relax. 5 million Americans were infected with COVID in the last week, 22 states seeing at least a 10% increase in hospital admissions. And in New York, a state Supreme Court judge overturning Governor Kathy Hochul's mask mandate for public indoor spaces, calling it unconstitutional and unenforceable. The governor vowing to appeal.
And the federal government is now distributing more than 400 million free N95 masks. A lot of them will be going through national chains at 3 masks per person. Walgreens says they'll have them Friday. Rite Aid says they'll have them in some stores this week, with all of them getting them by early February. And CVS says they'll have them in the coming weeks. They'll pass them out as soon as they get them from the government. Kira?
All right, Trevor, thanks so much. And joining me now for more, Chief Innovation Officer, Boston Children's Hospital, and ABC News medical contributor, Dr. John Brownstein. So, Doc, the Omicron-specific vaccine booster, let's talk about this. What more do we know? What kind of difference could this make?
Well, Kira, we've spoken a bunch of times about the idea that the vaccines need to catch up with this virus. As the virus evolves, and we can adapt our vaccines. And these trials are essentially testing this. It's an Omicron-specific booster, but also looking at Omicron-specific vaccine as a 3-dose series. I think the idea is to look at safety, tolerability, level of immune response in a small group of people and be prepared. The important thing to note here is the existing vaccines in the market are still doing incredibly well. We had studies last week showing that if you're fully up to date and especially boosted, you can limit your risk of transmission, but also of severe disease and death. So existing vaccines work, but it's important to stay prepared for what might come and where we might be in the future with this pandemic. The results of these studies won't be available for some number of months. Moderna is also working on similar studies, but it's not clear how the FDA and CDC are going to recommend this new version of the vaccine. So we sort of have to wait and see. So for those who are still debating on a vaccine, get what's on the market. They still work incredibly well.
Well, the FDA has pulled emergency authorization for the monoclonal antibody treatments by Regeneron, also Eli Lilly. What does this mean for states with high hospitalizations right now, where they were relying on those treatments? Do you think this is a good idea?
Well, the FDA has to be nimble. We have to keep up with the science. And as I mentioned, these viruses are evolving and our treatments may not work down the road. And this is what's happening for these monoclonal antibodies. So it makes sense that in the short term that, we're not giving therapies to patients that don't work. These therapies are failing for Omicron. Maybe in the future, we might be able to bring these back depending on what the next variant is. But for now, we should be focusing on therapies that work. And we still have the Merck and Pfizer antivirals. Those are on the market. Those can work incredibly well. But we just have to be nimble. We can't depend on things that worked for the Delta variant that necessarily won't work for Omicron. We have to give patients, what they need to get actually better from this virus.
And in the middle of this, the World Health Organization is saying that the variant could be ushering in the end of the emergency phase of the pandemic. So as an epidemiologist, what's your response to that?
Well, I think we have to acknowledge that we're going to be in a position of living with this virus, and we have better tools, like I mentioned, treatments, vaccines, better care, better testing. But I think it's early to declare victory. You know, every time that we thought that we're in a better spot, this virus continues to surprise us and brings us a new variant. So we have to be humble. We have to recognize that, yes, the Omicron surge is going to subside, but there may be another variant in the next 3 months, 6 months, and we have to be prepared, better prepared with new vaccines, better prepared with testing, better masks. We know what we need to do. So yes, we're getting to a better place with each wave, but we just have to recognize that, you know, we're not really at the end of the road just yet, even though things will be much better in the coming weeks.
So better masks. You know, the White House is distributing more than 400 million N95 masks now for free. So when you say better masks, are these the only masks that really keep us safe? Because, as you know, so many of us have all kinds of different kinds of masks.
Yeah. Well, yeah, I mean, I think that the time is now to double down on better masking. We've said this for a while. The cloth masks don't provide, you know, nearly the same protection as a higher quality mask like an N95 or a KN95. There are many masks on the market that are better. Of course, there's also the surgical mask. If you can double mask cloth surgical, that might work. But yes, now we're going to have the availability of free high quality masks at pharmacies. I think anybody who can go and get one and get 3 per person, absolutely do it. It will limit your ability to catch this virus and to spread it to others. So just to get through this Omicron wave and maybe a future wave, time to upgrade your mask.
Dr. John Brownstein, thank you so much, Doc.
Thanks, Kara.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.